Good afternoon.
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 Good afternoon.
Good afternoon.
Good afternoon.
Good afternoon.
Magandang hapon po sa ating lahat. Salamat, may araw na.
Sa ating lahat.
Eh, Daddy, hilahin mo pala yung aking anong sa initan, yung gabi. Ay.
Putong person na.
Wala naman siya. Sino? Bababa ka. Kasi isang oras. Ay.
Okay. Okay, we'll start. Good afternoon. Welcome all. As a reminder, please mute yourself, but always show your video picture. Sign in your name, Facebook account, email address in the chat box. Include the names of your companions. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and end of the pep talk. Okay. So show your face in the video. Take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate. I have placed the link in the chat box already. So this is a sample of the certificate that a mentee will receive after getting a perfect score. So let's now have a group picture taking before we start in 2 minutes. Okay, can you show your picture? Can you show your face? Wait. Okay. Let's have a group picture. 1, 2, 1, 2. May pahabol. 1, 2, 3. Okay. So I'll just save it on my screen first. Okay, my pep talk today is entitled Patient Management Process, Selection of Treatment Process. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I launched this pep talk on May 15, 2021 with a module on COVID-19. The second module was on patient empowerment. I am now on my third module, which is entitled Patient Management Process. What I have in mind in my pep talk, which may run for 3 years, I hope it will be less, is to empower at least 30 persons with my family members and my patients as a priority. This is my key performance indicator. I hope you will be in my group of 30. This is the patient management process framework. There are 6 parts in the module on patient management process: overview, clinical diagnostic process, paraclinical diagnostic process, selection of treatment process, advice to patient process, and peculiarities and limitations of medical practice. Today, we will be doing the part on selection of treatment process. So we will be focusing on this part of the algorithm or the framework, selection of treatment process. The takeoff point for selection of treatment process is the pre-treatment diagnosis. Before the selection of the treatment procedure, the physician decides on the pre-treatment diagnosis, which is obtained from repeated vigilant assessment of the accuracy of the clinical diagnosis and also the paraclinical diagnostic procedures or the paraclinical diagnosis derived from the laboratory exams and correlating the two. He advises the patient on the pre-treatment diagnosis, and then he spells out the objectives or aims of the treatment, whether in terms of cure or just palliation or other objectives. In the selection of the most cost-effective treatment procedure, the physician uses the BRCA processes. B stands for benefit, R stands for risk, C stands for cost, A, availability. The physician gives or lists the various options of treatment procedures and then gives the data on the BRCA. And then with the data given, the patient is asked what he prefers. Like this, the physician tabulates in the first column the various options of the treatment procedures, and then compares and analyzes the options in terms of the benefit, risk, cost, availability. When you say benefit, is the goal of the treatment, based on the goal of the treatment. How successful will be option 1 or option 2 or option 3 in achieving the goal of the treatment. Illustration number 1, okay. Greatest survival rate for option 1, the least survival rate for option 3, and then in between is the option 2. Okay. Let's suppose that the risks are all acceptable, minimal, and then the cost for each option will be 5,000 pesos, 4,000, and 3,000 respectively. And then let's say all the treatment procedures are available. So the question is, which is the most cost-effective treatment? So put priority on the goal of the treatment. Okay. So since option 1 has the greatest survival rate, it is the first choice. And then the 5,000 pesos is just not far behind from the, or not very different from the 4,000 or 3,000. Okay. So the choice here will be option 1. Illustration number 2. Option 1 and option 2 has the same survival rate benefit, but the risk for option 1 is less than option 2, and the cost is the same, 5,000, and both are available. So which is the most cost-effective treatment? Okay. So option 1, because the risk is lesser and the cost is the same, survival rates is the same. Illustration number 3. Option 1 and option 2 are equally effective. The risks are both acceptable to the same degree, but option 1 has 8,000 pesos as the cost and 4,000 for option 2. And both are available. So which is the most cost-effective treatment? Option 2, because it just costs 4,000 pesos. Another illustration. Option 1 is the most effective in terms of achieving the goal of the treatment. Then option 3 is the least effective. Assuming that all are have acceptable risk, but the prices are 2,000 for option 1, 3,000 for option 2, and 4,000 for option 3. And all of these 3 are readily available. So which is the most cost-effective option or treatment? So option 1, because it's the most cost-effective and it has the lowest cost. At this point, we now come to the selection. At this point, the physician should be explaining the processes of selection based on the BRCA to choose the most cost-effective treatment procedure and to the desire of the patient. Okay. So the patient has to be consulted. He can recommend, he waits and answers queries from the patient, allows the patient to decide, and forges a shared agreement. Once a shared agreement is arrived at, an informed consent or informed refusal is formalized. If there is an informed refusal, then the treatment is not executed. If there is an informed consent, the treatment is executed. So just before and during and right after the treatment procedure, the physician advises again the patient on the preparation, outcome, and things to monitor, etc. After treatment, so we are now on this box. After treatment, the physician advises the patient on health restoration and maintenance processes, the do's and don'ts, recovery period, resumption of major life activities, restoring and maintaining healthy lifestyle, etc. So with this step, the advice in health restoration and maintenance, one whole cycle of patient management, inclusive of the involved processes, is completed by the physician with full participation from the patient. At this point, I'd like to end this pep talk because we are just focusing on the selection of treatment processes. Okay, so the other 2 parts will be taken up in subsequently. So takeaway in this pep talk that are related to the patient empowerment. At this point of the pep talk, understand the patient management process framework in terms of what the physicians are doing and should be doing in the selection of treatment processes and health restoration and maintenance processes after treatment. Be ready to ask questions based on the requirements of the processes, particularly when the physician is not using the processes or is not clear or full in explanation. Participate actively and fully in the problem solving and decision making of your health concerns with your physicians in coming out with the most cost-effective treatment procedure and to your desire. Master the selection of treatment processes as they may help you in some way in deciding for your own health concern on how to choose the most cost-effective one and to your desire, particularly when there is no healthcare professional or physicians around to assist you. This is one other way of gaining greater control in your health concerns and issues. Although I like to end this pep talk at this point, I like to add some more. Okay, so there's an addendum. Okay. I would like to add the common issues related to the selection of treatment processes. Unnecessary prescription, expensive prescription, unnecessary operation, and generic drugs. So these are the 4 topics I'd like to discuss now. Unnecessary prescription of medicines. In the Philippines, it is a common expectation of patients that at the end of a medical consultation, there should be a prescription of medicines. This mindset is primarily instilled or influenced by the practice of a lot of physicians who would routinely prescribe at least one medicine, even when it is strictly speaking not needed. The physicians would usually like to shorten the medical consultation by prescribing a medicine rather than spending time to explain the diagnosis, the basis of diagnosis, treatment options, including why a medicine is strictly not needed. The physician's writing the prescription is usually a signal to the patient that the medical consultation is about to end. So, but strictly speaking, not all medical consultations should end up with a prescription of medicines. In fact, there are a lot of medical consultations that end up with clinical diagnosis that need advice only and do not need a prescription. If only the physicians will fully explain and explain clearly also the clinical diagnosis that strictly speaking do not need medicine for treatment, then there will be less unnecessary prescriptions, less side effects from the medicines prescribed, and less expense on the part of the patients. There are a lot of medical consultations that end up with clinical diagnosis that only need supportive management, like rest, change in lifestyle, hydration, nutrition, exercise, and hygiene. No medicines are actually needed. Examples in this era of COVID-19 pandemic, a lot of asymptomatic and mild COVID-19 patients are taking many unneeded medicines like antibiotics, vitamins, immune boosters, etc., despite the fact that the World Health Organization has declared that they are not needed. Expensive prescription of medicines. A lot of physicians prescribe medicines without regard to a patient's financial ability to procure. They don't use the selection of treatment process. They may be influenced by the trends and fads in medicine or by the pharmaceutical companies. Thus, it is important to discuss with your physician on the medicine prescribed, if there are alternatives or other options, other drugs which are as effective but cheaper. And do not hesitate to ask if the medicine has a generic counterpart. Unnecessary operations. There are a lot of unnecessary operations going on. Here are some examples that I'm aware of, and these are part of my advocacies. Beware of unnecessary operations for gallbladder polyps. There's no need if the polyp is less than 1 centimeter in size on ultrasound. Beware of unnecessary breast biopsy for suspicious lesions reported by the radiologist, because this may turn out to be fibrocystic changes. Beware of unnecessary breast operations, especially for macrocysts of the breast, which can just be treated with needle aspiration with no need for an operation that is called excision or removal of the mass. Beware of unnecessary thyroid operations, which may not be needed for small, benign thyroid nodule. Generic drugs. A commonly asked question, is it advisable to use generic drugs? My answer is an outright yes, it is advisable. So what are generic drugs? A generic drug is a medication created to be the same as an already marketed brand name drug, the same in dosage form, safety, strength, route of administration, quality, performance characteristics, and intended use. A generic medicine works in the same way and provides the same clinical benefit as the brand name medicine. In other words, you can take a generic medicine as an equal substitute for its brand name counterpart. How come the generic drugs cost less than the brand name medicines? Generic drugs tend to cost less because the generic drug applicants do not have to repeat the animal and clinical human studies, which are very expensive, okay, that were required of the brand name medicines to demonstrate safety and effectiveness. Are the generic drugs at par with the brand name medicines? Yes, because they contain the same active ingredients as the brand name medicine. Also, the Food and Drug Administration has already looked at the quality of medicines before they are approved to be marketed in the country. So thus, the generics should have the same quality as the branded ones. If the generic drugs are fake, so beware of the fake ones, and not approved by the FDA, then they may not be safe and effective. Thus, it is important to get medicines only from FDA-approved pharmacies. If we take a look at the selection of treatment process, remember this table? It is but rational to choose the generic drugs because they are as effective, look at column 1, as the brand name drug, same risk, okay, but cost less, okay, 4 times less for the generics, okay. So the choice really is that is for generic drugs, okay. So to conclude, it is advisable to use generic drugs as they are more cost effective. So with that, I end my PEP talk today, Patient Management Process, with a subtitle of Selection of Treatment Process. I hope I have empowered you to have a better understanding of the selection of treatment process in the patient management process. Now, before we go to the open forum and interactions, as a reminder, please take the online COMB evaluation test exercise for mastery of learning and have a perfect score to get a certificate. And then I have placed the link in the chat box. So let's now have a group picture taking before we go for the interactions. Okay. Ready? Somebody's connecting. Let's wait for a while. Okay, we want to wait for that person who's connecting. 1, 2, 1, 2, 3. Okay. The floor is now ready for questions, comments, okay, and other interactions that you want to have.